right, we're giving it just a minute while everyone's loading in. All right. Good afternoon, everyone. I'm April Childs Potter, president of the Nashville Healthcare Council. Welcome to each of you joining us today for our brass tacks discussion. With this series, we bring together board members, C-suite executives, influential leaders to candidly share their insights and experiences during this rapidly changing time. Basile is Dr. Frank Basile, CEO of Aegis Sciences Corporation, who brings extensive experience from his training as a physician, a strategy consultant, and a healthcare executive, is joining us today. Frank, welcome, and thank you so much for being with us.
Thanks, April. It's a pleasure.
Wonderful. We're going to dive in. Now, Frank has shared some incredible Nashville trivia knowledge with us in the waiting room before this call. We're not going to get to that now, but if we have time, I am going to ask him to share a couple of nuggets because they're pretty incredible facts. But for now, we'll just stick to business. Frank, let's start off by just hearing a little bit about your background. Can you share your career trajectory with the group today?
Sure. Thanks, April. So I'm originally from Melbourne, Australia. As you mentioned, I trained as a physician. I practiced in primary care for about 7 years, and I worked as a strategy consultant for McKinsey & Company. Then I was in dialysis for about 10 years, and I've been in the lab industry for about 10 or so years as well since then. And I joined Aegis in 2017, April 2017. Yeah.
Wonderful. So tell us a little bit about Aegis Science Corporation. What's your mission? And give us a little background about some of the work your company is currently doing.
Right. So our Aegis's core mission is to help clinicians make better decisions. And essentially, according to CDC, about 70% of medical decisions depend on diagnostics. And we're right in the heart of that. We are really kind of in three main areas, I would say. The initial business of Aegis was in medication adherence, medication monitoring, which is urine drug testing, oral fluid testing. We also have a fairly significant molecular lab. Most recently, we've been doing a lot of COVID testing, but we're also testing other infectious diseases. And we also offer clinical labs, just the normal, liver function tests, renal function, the normal kind of clinical labs that most people are probably well aware of. So they're the three main areas we're in.
Frank, what was the inspiration? So you've joined the organization after a career in several different areas. Give us a little background on your inspiration behind joining Aegis, and what are your hopes for the company's future here in Nashville?
Right. So, I mean, I think personally, diagnostics lab science. Diagnostics is a really important area because so much depends on the lab and getting the lab results. And so that's been a really important and really interesting area for a very long time for me. And Aegis specifically, it's a very science-driven culture. It's very innovative. And we have really a lot of opportunity to create, kind of new and novel tests that can really add some value. So I thought Aegis was a really kind of interesting player inside the lab space. So that was what attracted me. In terms of our future, we're really focused on continuing to sort of build on the strong base of science to continue to innovate and diversify the business. I mean, we've seen a lot of growth over the years, and we'll continue to do so, I think, and continue to establish kind of new testing and new opportunities for diagnostics in the main areas that we're in. I mean, that's really our key focus.
Sure. Well, I hesitate to say crisis, but the last several years, you joined the organization in 2017. Obviously, the last 2 years have been a bit of a whirlwind. Could you share a little bit with the group about your organization's culture and your leadership philosophy, and maybe how some of this played out? You guys were a critical player in the last 2 years in terms of the COVID era. Share a little bit about how your leadership and culture evolved during that time.
Right. Well, I don't want. I think I'll say that we were really very fortunate in many ways because we had a tremendous group of people, fantastic team with a set of skills that were really applicable to what was going on. From the get-go, we knew that we could run a high throughput lab. We had the skills and capabilities to do that, and that's basically what we do. And we knew that we could bring tests and innovate around testing to not just provide accuracy, but also streamline and make the process more efficient. So we kind of felt like we had some capabilities to bring to bear, and we entered into the COVID testing with the mindset from the very beginning that we were going to overinvest. So we honestly did not know what would happen, but we thought the scale of this could be huge. So we decided from the get-go to design everything to be at least double what we needed at the time. And so we started with that mindset. And so we began testing in April of 2020. And we built the lab, the staffing, the supply chain, everything around it to scale as quickly as possible and to stay ahead of that. And it worked. I mean, we had we really did a very well with turnaround time. A lot of labs struggle with this. We were able to stay ahead of that. And we were really, I think, fortunate in the sense that we were able to sort of kind of move through the pandemic and really support our customers, our clients, as well as sort of the community with something that at the end of the day was probably better than what was mostly available. I think that's really, but it sort of stemmed from the capabilities that we had, which was fantastic team and lots of skills, and then just the idea that we were going to overinvest. And we literally spent a lot of time just building capacity before we needed it, which is probably, well, for us at least, seemed like the only way to go.
So I love that idea of overinvesting on the front end. You kept saying, staying ahead. Do you feel like that preparation really helped change the trajectory of the organization going into the pandemic?
Excuse me. Sorry. Well, I think the direction of travel was always going to be molecular testing and clinical lab testing and more diversification. I think the direction of travel for Aegis from 2018, 2019 to today would have been really the same. The thing the pandemic did was it changed the amplitude. It made everything significantly larger. Initially, our core business dropped by about 70%. And so we really were looking at, just kind of a really bad situation. But then, of course, it came back over about 18 months. But, with the molecular testing, the COVID testing, that obviously filled that hole and then some. But so we were able to kind of ramp up a lot of capabilities and skills and accelerate things. I mean, I think that's really the major thing. The acceleration from the pandemic is really the most important thing that we experience as an organization.
I bet you were glad you were so well prepared, though. Well, Frank, we touched a little bit on this at the beginning when you started talking about the laboratory science role in the healthcare ecosystem overall, but Aegis testing services are designed for the unique needs of particular specialties. How do you view the role of the company in relation to the overall healthcare ecosystem, and what are some common misconceptions that you might like to clear up?
Right. Well, I'm going to mostly, I think, focus on the medication adherence, the medication monitoring testing because that has been in the history of the company the largest business. And we really view that we serve the community, our clients, and their patients, and our major focus there is to reduce risk. At the beginning of the pandemic, testing declined by about 70%. This has been documented, and so in March of 2020, testing for medication monitoring, especially amongst people with pain management or addiction, declined significantly. And since then, we've seen a sort of massive increase in overdose deaths, about 40% increase in overdose deaths. And and these two things are not unrelated. Less testing and less vigilance leads to more risk and more death. And so one of the most important things that we think about is how we can communicate that clearly to people to make sure they understand the risks that are out there and take appropriate action. So we really kind of see our charge as being kind of fundamentally to help doctors and their patients avoid the risks that are just out there constantly with the environment that they're in. So and then sticking with sort of this area, kind of two misconceptions I think around it are, and this applies to a lot of lab testing, but mostly in the area of medication monitoring, because it's an area that is, I think, fairly misunderstood. People think that it's not entirely necessary, and that it's really easy, and the not entirely necessary. We still meet doctors who don't test or don't test appropriately, even though they're managing patients with pain or sometimes even with addiction. Managed care organizations also seem to have a belief that this should be limited to the greatest extent possible, even though that could be harmful to patients. So that misconception is something that I think we kind of battle on a constant basis. And then the other thing that's easy, that you can just use a cup or a strip or an analyzer, and you can just get a result. And that creates like a false sense of security, because a lot of what we test for, a lot of what we find are synthetic drugs that are designed to evade these kinds of simple means of detection. And so, you'll do a test, doctors will do a test and get a result and think that everything's fine, and it isn't. And I think that's the other misconception that we deal with on a daily basis, which is the idea that I've got an analyzer, I use cups, I'm all good. And that doesn't work in this era of synthetics and just this increasing array of substances that people are encountering on a daily basis. So they're the two main things. In general, though, with lab testing, there is a sense that it's in the background. It's sort of something that people kind of feel like it's there, but they're not really, not entirely sure all the time that it's necessary. It's clear that lots of decision making depends on accurate results, fast, timely results, and so that's something that I think in general the lab industry needs to do a better job of just explaining, because it's taken for granted. I think that's something that I think we need to sort of push against.
During 2021 and 2020, during 2020 and 2021, it's hard to remember which year we're in right now. Between 2020 and 2022, Aegis received $11.3 million in NIH grants to expand COVID-19 testing, as well as $3.2 million from HHS. Do I have that right, Frank?
Yeah.
What led to that opportunity for you all?
Right. Well, I think I mentioned earlier, right from the outset of this, we decided to perform at a level that was going to be, what we deemed to be reasonable, but what other people thought was exceptional. And we came to the notice of NIH and we came to the notice of HHS. at the time, the government was looking for labs to partner with to kind of increase testing capacity as much as possible. And so we came to their notice and we had to submit, sort of a bid, I guess, or a white paper outlining what would we do with, funding that they might give us. And it was a fairly open-ended kind of request. And we met with them and talked through these things. And they were fairly, critical of our plan and so forth. But they decided to invest in us because our plan was credible and because we had a track record. We were doing things that other labs weren't doing. And so we received funding in state. It was all in stages. There was 3 million, and then there was another 3, and then it was in stages over time. And each stage, each time, we over delivered, and we delivered, ahead of time, and we delivered the capacity, and we were utilizing it. Because the other thing that they wanted to know was, could we, if we built a big lab, could we actually bring that capacity into the market? Could we use it? And so we had a partnership that we were developing with Walgreens. And so we were able to kind of demonstrate that we could, in fact, deploy COVID testing nationally, and which we did. And so that was also critical and important. So that are the main things that really drove that relationship. And it's been a great relationship. We still are doing work with the NIH. They're using us to do some genetic testing. We worked with the CDC on genetic testing as well. And so we feel like there's really, we've really established some really good relationships and a lot of credibility with those two agencies in particular.
Frank, it just strikes me, you're talking about this preparation, this investment, building and scaling this exceptionally well-operated organization. Talent's obviously the center of that, to scale these labs and to scale everything you're doing. That talent piece is so critical. We know between talent and supply chain issues, there have been significant growth constraints for companies. Can you talk a little bit about what you're noticing within your sector when it comes to talent and supply chain, and what solutions are you and your partners bringing in place to address those challenges?
Right. Excuse me. It helps that Nashville is a really attractive city for people. People come here, so there's a lot of traffic into the city. We have also, I think, taken advantage of the remote working and been able to recruit people across the country as well. So it isn't just who's in Nashville; it's also who's out there that we can bring in. So we've been able to kind of handle both. But in terms of the lab, we need people inside the lab because that's how that's done. We were able to. I mean, it wasn't easy. It was difficult actually, but we recruited. We had actually over 500 people working in the lab at its peak. This was up from about 10 at the beginning. So we're able to bring all those people in, and the labor market in Nashville is pretty healthy. I mean, there's a lot of healthcare companies here. There's a lot of skill here, and there's a lot of folks here who want to work in the space. So, it wasn't easy, but I think we were able to kind of manage that fairly well. On the supply chain side, at the beginning, it was very difficult to kind of secure everything we needed, but lately, I would say that it's not a problem at all. I mean, all those issues have gone away, at least for us, over the last 6 months. Even at the height of the pandemic, I think I would say that we have a fantastic logistics and supply team, and they were sourcing stuff from all around the world. And of course, we did have a lot of help from NIH, who were, once they partnered with us, they decided that they could bring some of their resources to bear to help us get some of the supplies and equipment that we needed, which probably not every lab could do. So that we were fortunate there. But I think most of those issues have now gone away, to be honest, on the supply chain. The talent issue is still something that's ongoing. Nashville is such a hotbed of activity on the healthcare side. even I get lots of email messages from companies asking me that, or telling me that they have great opportunities for me with them. So, and I get contacted by Thermo Fisher, for example. So, it's definitely competitive, but we've been fortunate in so far as bringing in the right people at the right time.
Well, it's great to hear that there's some relief on the pressure on supply chain. Let's talk about other issues that might impact your business. Is there any pending legislation on your radar that might impact your organization in the short or longer term?
Right. So there is a piece of legislation called SALSA, which is the Saving Access to Lab Services Act, which it's an act that undoes the damage done by the PAMA Act, which was the Protecting Access to Medicare Act, which actually PAMA would end up doing the opposite of that. It would actually kind of hurt Medicare. So SALSA is an act that the lab industry is right behind. It undoes the damage. It provides us a better framework. That's out there. If anyone wants to support the lab industry, there is a website, stoplabcuts.org, and you can go to stoplabcuts.org and register your support. It's an important area because PAMA really was going to gut or could gut the lab industry to a significant degree. So definitely SALSA is important. And then, in terms of other legislation, there's the Ballot Act, which is an act that gives the FDA jurisdiction over lab developed tests, which is, it's sort of an esoteric area. I won't sort of go into it too much with you, but it creates like another regulatory watchdog over the industry where we already have CLIA, we already have other agencies looking at us. So it feels like overkill, but there is sort of a push for that as well. So these are two things out there that one sort of positive and the other maybe less positive.
Interesting. I think you touched on the CVS partnership a bit, I believe already. But let's talk a little bit about collaboration. The last 2 years have proved that cross-sector collaboration in healthcare is so critical. Are you engaged in any unique partnerships or any partnerships on the horizon that you could share?
Well, we work closely with Walgreens. Yep. And we are in about 5,600 of their stores with COVID testing and with other kinds of testing. We are definitely, working with them on some other initiatives that they have going because they recognize that diagnostics is an important aspect of healthcare, and they are working toward integrating pharmacy and primary care. So there's definitely a growing and developing relationship there beyond COVID. And, we're really excited to be working with them because they have a national footprint and because the leadership they have inside their organization is very forward thinking in terms of like how they want to bring services to patients and to physicians and community practicing physicians. So that's a great partnership for us and definitely something that continues to evolve and grow. And then we're working closely with some other provider organizations in the urgent care setting. What we're finding is that there's a lot of interest in, partnering with a lab that can actually deliver, that can be responsive to their needs and deliver, services that grow with them. And we've got some very interesting things that we're doing in that space, but I can't get into that too much other than to say that it's also an exciting area for the company.
That is exciting. So I want to shift and talk a little bit about behavioral health. This is something we talked about a lot in our prep conversation. And it's certainly something that I'm hearing across the board from healthcare leaders. That's an ongoing challenge, both with workforce and also delivering care. Just the increase in drug, alcohol, other substance and synthetics. I know testing can be a big part of starting to address some of these behavioral health issues. Can you talk a little bit about how testing can help slow this behavioral health trend?
Right. Well, as I mentioned earlier, there's been studies now that the the 70% reduction in testing in the spring of 2020 and then through 2020 coincided with the escalation in not just the usage of illicits, but also the adverse consequences, overdose and death. So testing is sort of vital for actually managing this. If you don't measure it, you can't manage it. It's impossible as a physician to do that. 10 years ago, there were no synthetics. It was basically heroin and other drugs that were basically grown in a field, purified, and then sold on the street. Now, most of the drugs that are out there that are coming, most of the illicits are manufactured in a lab. They're synthetic opioids, synthetic or designer benzodiazepines, and all kinds of other stimulants, new drugs like xylazine, which is a tranquilizer used in veterinary medicine. It's been combined with fentanyl to create, just another kind of bad substance that people can encounter. So there's a tremendous amount of turmoil and change in this space, and it's constantly evolving. And people, the folks who are making these substances, design them to give you more bang for your buck, I suppose, and also to evade detection. And so it's important, if you're a provider in this space or just want to avoid risk, to make sure that you've got testing that can help you identify these things. As I mentioned earlier, not every type of testing can detect these substances, these new and novel substances that are constantly coming into the market. And not every lab that uses sophisticated techniques is also equipped to do this. I mean, at Aegis, we commit to, again, this sort of comes back to the idea that we want to overinvest. We change our test menu every 6 months because we know that there's new products coming into the market on a constant basis. So we work with various sources to identify kind of what's out there, and then upgrade our menu to make sure doctors can see these things in their patients. And this is a critical component of managing this. And we get testimonials from doctors on a constant basis who tell us that, I had overdose deaths. I had patients who were getting into trouble. And now with your testing, I can identify when they first might encounter a synthetic fentanyl or synthetic benzodiazepine or a designer benzo or some other stimulant, and they can work with the patient to kind of get them off or to move them away, make them aware that these risks are out there and it's only a matter of time before they end up dying. So testing is vital for this, and not all testing is created equal. You need a lab. First of all, you need sophisticated methods, and then within that, you need a lab who continues to evolve and change its test menu to deal with this sort of arms race that's happening, because the substances are constantly evolving and changing, and if you stay in one place, you get left behind.
Wow. Speaking of staying on one place and getting left behind, COVID's really increased the impetus for alternative science and really thinking about the different ways to access care, namely in telehealth. Aegis is taking the viewpoint that you need to meet the patient where they are. You talked a lot about that already. How can alternative science or that telehealth piece help with testing in substance abuse disorders?
Right. So, this is really important because, with the advent of telehealth and with, it's convenient and it is a great boon for people. It also, at least initially, negated the ability to test. And so we've created testing, mostly saliva-based testing that can be done on screen. You can proctor it. We've created tools and techniques for doing that. We're actually now working with some chains of behavioral health providers who want to be able to offer this service to their clients and who kind of understand that, you know, the way for them to bring the way for patients to access them is through telehealth. And so this is something that I think is going to just be increasing. We can't force patients to do stuff that they don't want to do. They're going to choose whatever they want to choose. And so we just need to be able to kind of offer options that, you know, get the job done, because there's no alternative. They have to, you know, you have to test. I mean, you just have to do that. And so finding a way to kind of do that easily and conveniently is definitely important for us. So telehealth is something that's here to stay. We just need to be able to work with it and work with our customers to offer them solutions that, you know, get the job done, as I said. Yeah.
That's interesting. In the area of healthcare services, innovation has accelerated a lot in the last 2 years. You know, an industry that has historically not been known for rapid change, really had to change overnight in many ways. Do you feel like that same innovation that was happening in healthcare services has been the same in your sector? You've talked about some of your innovation. Does that reflect what's happening in your sector as a whole, or is that really more unique to your organization?
Well, you know, nothing matches the innovation around mRNA vaccines. I mean, that's an extraordinary piece of innovation that came into the community over the last several years. So nothing that we do is anywhere close to that. But on the lab side, I think lots of labs are looking for different ways to create biomarkers and other testing, genetic testing, especially to personalize and find ways to, detect disease and offer up solutions for treatment in a much more personalized manner. So there's a lot of innovation in the lab world around that. Our space, we're a molecular lab. We do genetic sequencing. We do PCR-based testing. So we've created a number of tests in infectious disease that we think are able to detect more quickly, more rapidly some of the pathogens that are out there. I talked a lot about sort of the medication monitoring and the innovation there around all these new substances. On the clinical lab side, I think, the normal kind of clinical lab testing is done by taking a blood sample. We think that there's an opportunity to do this through a drop of blood, like just a drop versus a blood sample. And if you can do it with a drop of blood, you can probably do some of this testing at home, or you can do it in places where there's not someone who can draw blood. So we think there's innovation and opportunity there to do something. Clinical labs are fairly, they don't change at all. I mean, they're constant, but that innovation is around the type of specimen. I mean, if we can take a drop of blood or a couple of drops of blood and do the testing, that probably will be beneficial for many patients. So there is a lot of work that's being done there as well.
We just had a panel 2 weeks ago to talk about another hot topic in healthcare, which was value-based care, what that means, and is it real? Is it coming? What's happening? That's really accelerated during COVID-19. We talked about telehealth a little bit, but COVID really pushed that to the forefront. Telehealth and value-based care are both relevant, and we're hearing about it consistently. Can these areas be applied to clinical and molecular testing? You've talked a little bit about telehealth already.
Well, in telehealth is definitely a way labs have to figure out a way to work in that space, because, a certain fraction of patients are just going to want to access care that way. And, dry blood spot testing, oral fluid testing, different ways to get samples, home test kits and so forth. I mean, there's lots of, Cologuard's a great example of something like that, which is, the sort of fecal DNA test. So there's definitely a lot of opportunity there, home and telehealth. In regard of value-based care, I mean, I think it's definitely an important area, and it's growing. We see this through our partners, pay for performance, risk-based contracting. it's pretty difficult for most labs to access this by themselves. I think it'd be difficult for us. I think it'd be difficult for a lot of other labs to do this, but with a partner, with a partner that had, other services like primary care and pharmacy and so forth, it's definitely, labs can actually be a really important part of that, because, lab testing can actually help you manage or reduce costs, because timely results can avoid, issues and problems. So it can actually be part of the mix. So I think that's definitely something that we're exploring. We're working on a couple of, I guess I'll call them pilots, and it's something that I think is going to be increasing. I know that I've been around for a fair while, and it's been something that's been out there for a long time. And I know there was a lot of heat and energy around ACOs and so forth, and some of them worked a lot. I don't think a lot did. But definitely, I think there is more impetus behind it, and we're optimistic that we can come up with we can work with a platform that can actually kind of get this done in an effective way.
How can the partnerships like the one that you have with Walgreens, the Walgreens and the government partnership, is there anything there that can help us prepare for future pandemics and epidemics?
Yeah. Well, I'm going to answer that by going two directions. So I'm going to talk about monkeypox first. So monkeypox is really interesting because, unlike COVID, the CDC from the get-go decided to tap into the private, sort of the commercial lab, and we were one of the 5 labs chosen to work with CDC on standing up testing in monkeypox. So initially in COVID, that was not the way they wanted to do it, but they kind of saw that was probably not the best way. In monkeypox, they decided from the very start to engage with commercial labs and to, make as broad a front as possible. So that was good, and that's a really interesting. It's a great lesson learned. Unfortunately, with monkeypox, they left the reimbursement. They left the reimbursement in the hands of these Medicare contractors, the MACs, and they set reimbursement below cost. So every monkeypox test we do basically is losing money. So if you really want to grow that testing, if there's a need for it, and monkeypox turned out to be, I don't think it's, well, we'll see. I mean, I don't want to comment on it too much, other than it wasn't anything like COVID. But if you had a situation like COVID, the incentives would not be there for people to get into that testing. So I think they've learned one lesson and maybe kind of didn't learn another, I think, on that side. We are working with NIH, and there's a project underway. John Hopkins is doing a project to kind of do a review of what happened and figure out how to kind of create a better plan going forward. They're working with government. We've also done a white paper. We gave that to NIH, and they've reviewed it. I think there's definitely, first of all, I think everyone thinks or believes that there will be something else coming down the pike. So that's we should be thinking, it won't be COVID. It might be similar, might be, but there'll be something else, and we need to find better ways to deal with it. And testing is just one of the pieces. There's other pieces, treatment and other things too, supplies and so forth. But we're definitely engaged on that question. And then in terms of the infrastructure that we built with Walgreens, we've created this national footprint, this ability to deploy testing right across the country really, really quickly. We've got all the IT connectivity built already. It's an asset that could be deployed pretty easily toward anything. And I think there's an appreciation in certain parts of the government that that's something that they want to find a way to preserve. It's in some form or fashion, but no one's really sure how. And like with a lot of things with government, there's also a lot of politics. So I'm sure, I'm sure, I'm sure we'll figure out, they'll figure out some way forward. Maybe, it'll require some level of accommodation all around, but there's definitely a lot of thought around it. And there's thinking now around kind of how do we, as a country, get ready for what might be coming maybe in the next 5 years, maybe the next 10.
Absolutely. Well, we're almost out of time for this portion, and I want to leave time for some of the great audience questions that I have in the chat. But I want to shift back to Nashville for just a second. As we, as an organization, continue to focus on building awareness of Nashville's incredible healthcare ecosystem, it's really important that we hear from leaders like you to tell us what we can do as an ecosystem to continue to attract talent and companies to this environment. So from your perspective, what does Nashville need to focus on to continue to grow our healthcare ecosystem?
Yeah, I'm not going to be able to give very good answers to this question, because I'm not a policy guy. I'm not. Look, Nashville's a really attractive city. It's got a lot of it's like a very relatively easy place to live by and large, and the environment's good and people want to come here. I think we get a lot of benefit from having a lot of other healthcare companies here. And so this the environment is, really, it's quite ideal in that sense. I mean, I couldn't tell you, and I mean, I'm not sure how this it came about, to be honest. I mean, it's sort of maybe there was some planning somewhere, but I would say that I couldn't really offer up a lot of suggestions for how to make it better. I know what we're doing. I mean, what we're doing is investing a lot in training and development. We are working with Vanderbilt on, some training programs that we're using with our people to kind of upskill, not just in leadership and sort of other areas. I think that it's a great resource for us and probably for the community. And of course, we've got one lab, national, it's based here. We don't do testing anywhere else. And we feel like I think that's definitely going to be the way we continue, because we get a lot of advantages of having everything in one place. But in terms of sort of other really good suggestions, I really couldn't offer too much, to be honest.
Well, that's good to hear as well. So just a reminder to our audience, we do have the ability for interactive question writing. I know some of you have submitted them in the chat. If you'd like to ask a question live, please just use the raise your hand feature on Zoom. But Frank, I'm going to toss you a couple from the chat now. First, with the amount of data you have access to, are there interesting partnerships that you could think of that could be on the horizon for connecting not only behavioral health to drug use, but also identifying trends around social determinants of health?
Yeah, there's potentially a lot we could do with the data that we have. We've done some projects with Walgreens on data analysis. We created with them something called the COVID Index, where we track in real time. We also uniquely we include vaccine data and clinical data in that. And so we feel like the combination of lab data, clinical data, to understand, better how a disease is changing and how it's impacting the community can be really powerful. On the behavioral health side, we've got a tremendous amount of data there. We just haven't fully explored that. It may be something that we do in the future. We've done work with Pfizer on vaccines and so forth. We've done that with Walgreens, and we're also working with the Bill and Melinda Gates Foundation. We have doing a project with them on pathogen surveillance. There we're creating, we're doing testing, but also creating a framework that can be deployed in third world, other parts of the world, to rapidly understand sort of, again, clinical, the nexus between lab testing and clinical to sort of shape and manage a population. So there is some real interest in it. It's just something that we haven't really got into so far on the behavioral side.
Well, sticking with the theme of data, how is data on dangerous drug trends used to obtain and disseminate to healthcare providers and other key stakeholders? Just that trend information, how is that data being used to communicate those trends to healthcare providers and key stakeholders?
So we get access to this information through a couple of sources. The DEA publishes this information. There's also a Center for Forensic Science that publishes this information. So they're publishing on a regular basis what's new and what's out there. We scour that material and then use that for our testing. We also communicate that to our clients. We conduct a lot of public events. I think we have a KOL panel next Wednesday that we will be running on designer drugs with representation from the University of California, San Francisco, and University of Maryland, and the Center for Forensic Science. So we're doing as much as we can to communicate what's out there, what's happening, and what you can do about it. I'll be honest, I'm not fully aware how much that information filters out into the community from government. I'm not fully aware of that. I know that it's out there and it's accessible, but I don't know. I'm not really sure of any other means that I could name for that dissemination.
Could be a great opportunity. So Frank, every 2 years, the Nashville Healthcare Council hosts an international study mission. And the intention of that is to bring together our C-suite leaders from here in Nashville and beyond to study great innovations that are happening in other countries and really learn from those organizations. Does Aegis work on the international front at all? Are there any innovations you're seeing internationally that are really inspiring that we should have on our radar?
That's a great question, April. I'm going to, first of all, Aegis is US based. We are working, as I said, with Bill and Melinda Gates Foundation on a fairly significant project that is about pathogen surveillance, not just COVID, but respiratory pathogens across the board. And that information is going to be exported to through the foundation to other countries. I think there's definitely a lot of interesting stuff that's happening in the world of vaccines. There's some really interesting innovation happening in my home country, in Australia, as well as in Europe. I think vaccines and especially mRNA type vaccines for therapy, like for cancer therapy and so forth, are really interesting. But otherwise, I'd be honest with you, I can't really give you too much insight on that sort of stuff, other than to say that it's out there and it's exciting at the level where, if you really want to see human health improve, it's definitely something that's coming and very, very important. The other big area is AI, and so AI services. Mm-hmm. So I am involved with a company that does AI on the pathology side. And so the advent of AI in diagnostics as well as in management and treatment is definitely an area that's going to, I think, flourish over the next 10 years. It's something that it's got a pretty good start in pathology, where you've got computer vision and the ability to kind of see cancer on a slide and fairly sophisticated techniques there that are at the moment now better than humans at detecting and seeing those things. And I think that's only a matter of time before it starts to kind of move into other areas.
Wonderful. I do want to highlight that there is an upcoming event that you all have that there's a link to in the chat if anyone's interested in learning more. about some of the topics we've talked about today. I am going to wrap it up with one final leadership question, Frank. It's been a whirlwind couple of years. I always love to ask leaders, if you could go back 2 or 3 years to yourself as a leader, knowing what you know now, what advice might you give yourself to prepare for what's coming next?
That's a hard one because you have to sort of imagine a different. Yeah, it's a hard one. I think if I could do something different, it would be to prepare for what's coming or what we sort of encountered. Going back to how we kind of worked on this, we tried from the very start to kind of be as forward thinking as we could. I'd say, to be honest, don't underestimate how bad it can get, because there was a period in 2021 when me and my entire executive team were actually in the lab, and we were working 18 hours, like, so we were 16 to 18 hours a day, despite the fact that we had ample staff. We thought we all were in there until 4 a.m. most days, and so do not underestimate how bad it can get. And so even though we tried to be as much ahead of the curve as we could, I think human biology and events can overtake our sort of our thinking, and are much more dynamic and much more unpredictable than we think they are. So and that's really kind of why, despite the fact that everything seems okay now, there are people in government who are thinking about, or trying to think about, how to deal with the next pandemic, because whatever's coming, it won't be the same, and it could be worse. And so getting ready and not under preparing, I think, is it's a message I took out of the last couple of years, and something maybe the community might take as well.
I love that message. It's like being a Boy Scout. Always be prepared, right?
Well, to the extent we can. It's kind of, look, it's interesting. The mRNA vaccines came out of funding that was provided by DARPA, which is a unit of the US government, in 2009, where DARPA put money into a small company called Moderna, and funded this crazy idea to, so that's amazing forward thinking. And at the time, they basically said, well, if there's a pandemic, this is going to be the technology that sort of saves us. And they didn't know what was coming. So that kind of, I think that's, some people might say, oh, that's a waste of money, because, like, how do you know? But on the other hand, obviously with hindsight, we know that was like prescient. And so these are the kinds of things where I always marvel at that sort of foresight and wonder, how, could I ever be that kind of person? That's a very difficult question to think about, because I'd hope to be that, or I hope we all would be that, but some of us may not make it. Maybe I would fail at that as well.
Well, you sound like a very forward-thinking and prepared person to me, and I'm sure all of our listeners feel the same way. Frank, thank you so much for spending time with us this afternoon. We're really grateful for your insights, your leadership, and for being a friend of the council. We hope that everyone's enjoyed this webinar. Thank you so much again to Frank, and we will see all of you soon. Thank you so much.
Thank you. Thanks, I appreciate it.